trends in follicular recount.
Thank you very much, Mr. Chairman. Again, thank you very much for this societal kind invitation. And I think I'll be talking about new trends in follicular recruitment. So just to start, maybe I need to refresh your mind that at 14 weeks of gestation, the fetus start to develop what we call oogonia. The oogonia is about 7 million of them, which are the original part of the oocytes. But only in the second and third trimester, the primordial follicles start to develop. And here they start what they call the first meiotic division, and they freeze at that. So the girl is born with a frozen and first meiotic division till she reaches puberty. What will happen in puberty? The gonadotropin release start to work on these primordial follicles and to convert them into what we call the primary follicles, where we find more granulosa cells layers and start to feed these oocytes and make and give the antral follicles. So from this, we can see that the granulosa cells is developing FSH receptors, and those FSH receptors, they affected by the FSH release, leading to the development of the follicles to reach the antral stage. Now, because of time limitation, there is lots of new trends in follicular recruitment. I'll be talking about just two conditions, and these are, number one, the oncofertility, and number two, the subfertile PCOS patients. So, to start with, the oncofertility, applying the random start stimulation. Here we have a malignant case of patients who needs really to go on, for example, on a chemotherapy. And you don't want to wait till she has the period and then start stimulation on that. So you want to have a quick start, and that's what we call it, a random start of stimulation. But is this scientific, or is this physiological? Well, we have seen the usual, where under the stimulation of FSHs, then the small pre-antral follicles start to grow, and then they have reached the stage of what we call the antral follicle development, and then lead to ovulation. Fair enough. But what will happen really, I want to draw the attention to what we call the cyclic chemotherapy. Here is the yellow curve is representing the FSH. And I want to draw your attention to the last 3-4 days before the period start, day 24 or 23. Here there'll be a little bit rise in the FSH. Most of us, we ignore it. But at this stage, actually, there are already some primordial follicles, that the small ones, has been recruited. However, only one, the one with the highest FSH, the one that got the ovulation. So what about the rest of those follicles that has been recruited, but they haven't been really reaching the size for ovulation? So these are actually ready follicles to be primed with this level of FSH. And that's why, even in this situation, we can have within the same cycle another progress or development of secondary follicles reaching to the stage of ovulation. The third one, people claim sometimes this can happen even 3 times in one cycle. So can we see this? Yes, we can see this. That, for example, here the ovulation takes place, and the luteal defect release here, and then another one start to grow again and start to give another follicles within the same month. So here, actually, this can be used what we call as a random start stimulation. There are lots of IVF specialists have worked on this, and they actually sometimes they do 2 ovum pickups in the same month. So this is the basis behind it. Now, what we see really most of the time is that, for example, the situation when you have a late follicular phase start, can you see the start here is starting in the 9th day, or sometimes even the 10th day, and still you have that LH drop down, and then with the rise in the FSH, the follicle size start to grow, and you're going to have ovulation here. Even if you start late, you're going to have ovulation later on. So this is really an open ground, really, of small follicles ready to be stimulated during the month. This is even a very luteal phase start. We have already ovulation done, But what happens here is that the eyelashes goes down and the stimulation, because it started at day 18 or 19, and still we're gonna see a rise in the follicle size. I can see it here, and we're gonna have ovulation later on. So regardless of what day of the cycle we're in, still you can start your stimulation, and you're gonna have, ovulation as a result. So when you talk about oncofertility, you have to think about two things whenever you start the random start. Number one is the use of the aromatase inhibitors. As you all know, aromatase inhibitors blocking estrogens. And we need this because we use this for oncofertility patients who are, for example, breast cancer or endometrial cancer, and they are sensitive to estrogen. So we want to lower that. Normally, with your stimulation, you increase the level of estrogens. Here, use the AI, letrozole, whatever, and that will lower the estrogens for you while you still continue your stimulation. The other thing is to keep in mind, because we have here random start ovulation, this stimulation, usually we don't have a synchronous development of the endometrium at the same time. And that's not good for implantation. So what we do freeze all the embryos, and then we start a new cycle for a thawed, frozen embryo transfer. The second point here discuss the subfertile PCOS, and the thing I'm going to discuss here is the use of antioxidants. Now, we all know that the oxidative stress is a balance between the reactive oxygen species and the antioxidant effect, the local, the one we have in our body. So what will happen, to keep that balance, we have to get rid of those reactive oxygens by working or losing some ions from the antioxidants in order to keep that balance. And what will happen if you have more reactive, of those reactive oxygen species, and the oxidative stress is going lower down, there will be apoptosis of these follicles. Now, we know in cases of PCOS that these are actually produce a significant decrease in the serum antioxidants. They have also lower levels of antioxidants in their blood, and also they have high oxidative stress. In addition to antioxidant supplementation has been shown to be effective in this woman. So what we see here is just, for example, I give you the L-carnitine, acetylcarnitine as an example, where it has been shown that it will actually maintain the cellular energy, reduce oxidative stress, and also minimize the cell death, which is apoptosis, which are necessary for oocyte growth. So it has that kind of direct effect on the follicles. At the same time, it has an indirect follicle by affecting the gonadotropin release and the GnRHs, and that's how we have a better outcome with PCOS. It's not just the L-carnitine. We have many others. For example, we have the vitamin D, inositol, vitamin E, zinc, and sodium, selenium, and all these as antioxidants work together to help, give you better results. The oxidative stress and the outcome with the use of antioxidants, in fact, is represented in this study beautifully. What they did, they had 200 patients. 100 patients received minerals and vitamins for 6 months. The other 100 did not. And what they did, look at here, they actually looked the level of these antioxidants, E, C, vitamins A, and zinc, selenium. And you can see before treatment and after treatment, there is an increase in the amount of those elements. So that's number one. Number two, also, our endogenous antioxidants. What are they? These are what we call the glutathione peroxidase, the superoxide dismutase, and the catalase. These are our endogenous antioxidants. They found that even those ones, with just giving those minerals, all right, have increased also with this kind of significant change over the 6 months. So we see here, just by giving those minerals and vitamins, we have switched and increased the number of these endogenous antioxidants and the minerals. All right, then they gave these two patients, a group of patients, stimulation, just simple clomiphene citrate. I'm not talking about AI. And you can see here the pregnancy rate in the treated group was 22% and only 2% in the placebo. The huge difference. And all what they did there is just they gave the antioxidants, minerals, and vitamins. And so, as a result, studies came out from all over the world talking about the use of antioxidants. Well, I have to be really very careful here because the long stimulation in this study was 3 months. Remember, the original study that really gave us the concept of this was 6 months treatment. These people, they use 3 months, but again, they have PCOS patients using clomiphene citrate and metformin, and both groups. This one placebo, and this one received the levocarnitine. And then, after the stimulation, we can see here, actually, the ovulation rate was completely different. It's much better with those who use the carnitine. Also, the pregnancy rate, 28 versus 7, which is, again, much better. I mean, the world never stops, but I was amazed to see this study coming up. Really, I mean, they used patient never given antioxidant. It's just during the stimulation, they give her the L-carnitine. It's concomitant short supplementation. I mean, well, they give the clomid for 5 days as usual, but in this patient, they gave her also L-carnitine 3 grams a day. Well, that's the usually recommended dose. However, they show the difference. Actually, the mean number of follicles, it's higher. The endometrial thickness is much better. The luteal phase serum progesterone is much better. So you can say with this study by Ismail, I mean, that even concomitant, very, very short, I don't call it short, use of antioxidant can give a result. I'm still a little bit skeptical about this kind of result, but however, science is developing and maybe can be proven one day. So, in summary, ladies and gentlemen, ovulation induction is a critical and dynamic process. Proper understanding of follicular recruitment has extended our vision to tailor the technique according to the need and the circumstances. Random start stimulation has now become standard practice for women requiring fertility preservation before chemotherapy. Finally, antioxidants play a critical role in managing difficult fertility issues such as PCOS and poor responders. Thank you very much.
Thank you very much, Professor Hisham. And